The heart is one of the most important vital organs in the body. It pumps 7,200 liters of blood per day to deliver nutrients and oxygen to cells and tissues throughout the body. Now, just like muscles, the heart is also a cardiac muscle, and it also requires oxygens and nutrients. In order to receive oxygens and nutrients, it has to be delivered through blood, and this blood is delivered through the coronary artery. Now, the coronary artery is actually a hollow tube that acts as a transport for blood to the heart. Now, the tube itself is actually covered or protected by an endothelium layer on the inside, and this acts as a physical barrier. For individuals who are affected by the coronary artery disease, often have their tubes being narrowed. Now, when their coronary artery tubes are narrowed, this causes restriction for blood to flow to the heart. Now, there are two conditions which causes this to happen, and this includes atherosclerosis and atheromatosis. Atherosclerosis causes general thickening and stiffening to the arterial wall. This is mainly related to high blood pressure and hypertension. Whereas atheromatosis is an inflammatory arterial change, where cholesterol and fatty deposits build up on the wall of the coronary artery. These build-up causes a slight injury to the vessel walls, consequently allowing other substances such as cellular waste products, proteins, and calcium to get stuck into the vessel walls. The combination of fat and other substances combine to form plaque, and this restricts blood flow to the heart. As the disease progresses, plaque, which is soft on the inside and hard on the outside, starts to crack and tear, causing platelets to come and clot around the plaque. This causes the endothelium wall of the vessel to constrict at an inappropriate time, which narrows the blood vessel even more. Ischemia is also another condition that occurs with the disease. It occurs when the artery cannot supply enough oxygenated blood to meet the heart's demand. This causes the heart to become starved for oxygen. Now, this condition causes the heart to also cramp, which leads to angina. And in worst case scenario, silent ischemia can also occur. And this is where there is no presence of chest pain at all. However, a heart attack can occur at any time at that moment. As mentioned before, some of the symptoms include pains around the chest and rapid heartbeat. However, some of the other symptoms also include dizziness, nausea, weakness, and severe sweating. Nevertheless, women actually have a quite somewhat different symptoms, and this includes, as usual, pains around the chest, however, with a severe discomfort also, and the pain also leads to a back pain or a pain on the arm. They also experience unusual rapid heartbeat, which then later leads to fatigue. Are you at risk of developing coronary artery disease? Basically, if you're 40 and above or are a male, then you're more likely to develop coronary artery disease. However, there are also other factors, and this includes high blood pressure, high sugar volume, high cholesterol volume, and those who are actually affected by blood coagulation factor. Since the disease does not show any signs or symptoms in its early stage, the doctor actually diagnosed the disease based on the individual's family histories, also the risk factors and physical examination. Now, there are several ways in diagnosing the disease, and this includes using the EKG, electrocardiogram. It actually detects the heart's electrical activity, which shows the pace of the heartbeat and rhythm. Now, when the heartbeat and its rhythm is irregular, the EKG actually shows signs that the heart damage could be from coronary artery disease. There are also other tests, and this includes stress testing, and this tests signs of abnormal changes in heart rate, shortness of breath, and abnormal changes in heart rhythm. Blood tests also helps the doctor measure the concentration of fat, cholesterol, sugar, and proteins in the blood, which helps determine the individual's risk factor for coronary artery disease. There are several treatments available for the disease, and this includes interventional procedure, coronary artery bypass graft surgery, and medical management with drugs. The interventional procedure includes a narrow tube called catheter to be inserted through a plastic introducer, and it's guided to the coronary artery with the aid of X-ray. The interventional procedure involves attaching a small balloon to the tip of the catheter, and when it inflates, it compresses the plate against the wall, opening up the vessel and allowing blood to flow. This procedure is performed while the individual is awakened and takes approximately 90 to 220 minutes. There are some risk factors involving with this, and this includes infection, bleeding out the catheter insertion site, and kidney failure. Another procedure is the coronary artery bypass graft surgery, and this surgery is when one or more blocked arteries are bypassed by the blood vessel graft. This restores the normal blood flow to the heart. The graft is usually self-graft, meaning it comes from the patient's own artery. It could be from the arm, legs, or chest. The graft goes around the clogged artery to create a new path for the blood to flow to supply the heart with oxygen and nutrients. Lastly, the medical management with drugs is when user takes the aspirin, for example, or those who have diabetes along with coronary artery disease are more likely to inject insulin to reduce the blood glucose volume, and this would also reduce the high blood pressure, which reduces the effects of heart attack and angina.
Now, if you actually have the coronary artery disease, there are ways to prevent it, or if you don't have it, there are ways to reduce the risk of getting it, and that is to quit smoking or smoke as little as possible. This will not only boost your immune system, but as well as improve your bodily functions to fight against cholesterol clogging against the artery wall. This will also reduce blood pressure, as this will help having less blood thriving on the walls of the arteries. Also have a healthy diet. A healthy diet will also contribute towards diabetes control, which also reduce blood pressure in a way.